thank you for taking a few minutes of your time to let us talk to you about this important topic. We're here representing the American Association for Respiratory Care in the DRIVE4COPD campaign. And COPD, chronic obstructive pulmonary disease, includes bronchitis and emphysema. And it is the fastest growing killer in the United States. It's quickly approaching heart disease and cancer as a killer, and it's increasing prevalence every day. The key piece is to become aware of COPD, and a majority of patients that have COPD don't even know it yet. They have yet to be diagnosed. So it's important to be able to do this screening aspect that Wadie talked about there too. So most people think that COPD is almost directly related to smoking, and yes, that's a big piece of the development of it. But secondhand smoke is a big component of being in confined spaces with smoke, and in particular for the veterans, being exposed to irritants and pollutants in foreign countries and in confined spaces is a big contributing factor also. So common symptoms that we go through with the screening is shortness of breath, coughing, and a lot of people confuse this with the normal aging process, but early recognition is the key. So the risk assessment piece and being able to define this and be able to get to a doctor and get it looked into and get some specific pulmonary function tests to determine the extent of it and to do early treatment to mitigate the symptoms is an important aspect. I'll turn this over to Wadie and give you the rest of the great presentation.
Good afternoon.
Good afternoon.
Pleasure to be here. I'll dovetail on Kim's comments about early screening. We've been fortunate enough to see many of you today at the booth, and pretty much it's a painless process. It's 5 easy questions that actually reveal a lot about your lung health. The questions have been derived from a study of about 700 patients that was eventually published, so it's pretty solid, pretty validated. And the questions aren't hard, but the questions are very important. We would ask that you give us a couple of minutes of your time to help us make you become more aware about your lung health. For the first time, this is an unprecedented program that has been partnered with several different entities in the community, whether it's sports, arts, business, medicine. All of these groups have gotten together to try and raise the awareness of the general public about chronic obstructive pulmonary disease. It is by far the easiest way of finding out whether or not you are at risk. As Ken said, there are many, many factors that go into this, but if you're a smoker, have a history of smoking, if you're out working and exposed to dust, pollutants, and so forth, you're one of those people that we'd like to see. The other thing that's happened is there's a partnership that's been developed between our professional society, NASCAR, pharmaceutical companies to help bring this about. It's fully funded. We would like the opportunity to have this program out into the community through various groups, agencies, organizations such as the BFW, and our presence here today is to give you a preview of what you can expect. Whether you're in business for yourself, whether you're a commander of a post or whatever, if you would like to have this available to you, all you need to do after we're finished here is come to our booth, we'll get your information. The AARC, our national body, will contact you to confirm your interest. They will help find respiratory therapists in your community that will come to you, your organization, to deliver this program where you are. I think it's it's a great, great opportunity to raise the public's awareness about the fourth leading killer in our society right now in terms of health. Pretty much that's all I have to say, with the exception of this. To those of you who have served and made it possible for us who are serving and for those who are going to serve after us, thank you.